It gives me immense pleasure to record our last episode of podcast of 2024-25 with none other than our incoming General Secretary, Dr. Sachin Gupta. And it gives me a special pleasure because we are recording this podcast in our Criticare 2025, which is being held at Kochi. And as you can see, the backwaters of Kochi behind us. So, Dr. Sachin, welcome to the podcast.
Thank you.
So, I know your area of expertise is ultrasound in critical care. I want to start with that. So, what is the role and importance of ultrasound in critical care, and how we can actually bring it in our daily practice to help us do better decision making, help us guide our treatment for better patient outcomes?
See, all critically ill patients are dynamic in nature. So what was there at 8 a.m. in the morning may not stand to at 10 a.m. in the morning. So how do you recognize these changes very fast? And this is where ultrasound comes into the picture, because it helps you in repeated assessments. It shows you those changes, and these are visual changes. So it's not only the performer who is doing it, the entire team who is looking at it can appreciate those changes. Ultrasound has changed the way you manage these patients. All major societies guidelines have incorporated ultrasound as a part of their protocol because it increases patient safety. It enhances the clinical utility in terms that your diagnosis becomes more perfect. Your treatment is more tailor-made. We can't have a blanket rule for all patients. And this is where this ultrasound comes into the picture. Now the ultrasound machines are very portable, very mobile, so you don't need those bulky machines, somebody dragging those machines. So this is where this ultrasound per se from the pharmaceutical companies, if I look at it, they are also developing it more and more compact. Now you have handheld ultrasound machines you can just plug in into your phone and you can use it, because ultrasound, if you're not using ultrasound in your clinical practice, probably you are now almost a decade old, right? So you are lagging behind in the management. Most of the legal issues are also cropping up if you're not using ultrasound, and unluckily if you have a legal suit against you, you can be held culpable for it.
Thank you for answering that question so well. We all realize the importance of ultrasound in critical care and how it helps us in day-to-day practice in making better decisions, making more informed decisions, and of course, safer practices are definitely going to become the practices are going to get more safer with the use of ultrasound in critical care.
Thank you.
Dr. Sachin, let's discuss about one of the most sorted courses of ISCCM, that the FCCO course. It is one of the most successfully run course in ISCCM, and you are the main course coordinator. And it is so difficult to get a seat in that. I know you have limited seats for that course. So, on the behalf of all the trainees watching this podcast, I would like to ask, what can they expect from this course, and how is it going to help them improve their training program?
So yes, FCCO is one of the most successfully running courses. We started this almost 3 years back, and I would like to thank Indian College Critical Care Medicine for giving us this opportunity. This is a 1 year course, so we enroll candidates twice a year, one for the January batch and one for the July batch. We have 30 candidates in each batch, and from in the entire year, they would go through all sessions from head to toe. So the speciality of the course is that they have very trained faculties who are experts in the field of ultrasound as a part of the faculty of the mentor pool, and we try to interpret every single clip that the candidates who has been enrolled in this course, they collect their clips, they present it, and then we evaluate each clip, we give them the tips and the tricks that how to improve, what was good, what can be done better. And so it's a very tedious process. It's every Monday or every Tuesday we run this course for an hour and a half, and we encourage all the candidates to present their clips. So in an entire year, what will happen is they will go away with the shyness of using that machine. What they would gather is the expertise on how to manipulate the probe. They would also learn what are the major issues that they can handle in the intensive care unit. How can they optimize their treatment? So they would actually become an expert in that field, and it's a year-long course, so you require commitment from everybody. So whoever wants to join for the next course, yes, it is difficult. The course gets filled up in 1.5 to 2 minutes. So yes, best of luck for that. But if you are able to join, you're lucky to have enrolled for the course. Please be committed to it. try to present as many clips as possible, because then only you will become a better, I would say, a person who can manipulate the ultrasound. Just by listening the lectures or seeing what others are presenting, it would not take away that shy feeling of using that probe and presenting it to others. But it's an excellent course and one should be able to do it.
Thank you. So, for all the trainees out there, whoever is interested in having a successful career in critical care medicine, I really think it's a very important skill to have. As Dr. Sachin was saying, it is one of the most sorted courses of ISCCM. So, please enroll into it, and when you get a chance, please take it as seriously as possible and try to stick to the course till the end for successful completion and learning this very useful skill in critical care.
Thank you.